Welcome to the World United. Today, as a part of the initiative from the group of doctors under the heading Meet Your Doctor and Healer, for the past couple of weeks, we have taken up the initiative of apprising the people regarding various aspects of COVID-19. Earlier, we had experts from critical care management. We had experts from ENT. We had experts from general medicine, cardiology, etc. Now, herewith, I request Dr. Yugandhar Reddy to present the statistical analysis of the COVID-19 from global, national, and regional point of view. Over to Dr. Yugandhar Reddy, please.
Sir, my network is a little slow, sir. I'll just 1 minute, please. Good evening, everyone. Today, I'm going to present the COVID virus status throughout the world. So, total number of COVID cases as of now is 1,46,74,698 cases, total positive cases. Among them, 6,09,618 cases deaths were reported. 87,59,094 cases has recovered so far. So among the active cases, 99% of cases are in mild condition. 1% cases are in serious or critical condition. So daily new cases. Yesterday, the world has seen 2,20,162 cases, new cases. Deaths yesterday, the reported deaths were 4,316 compared to 2 days ago. It is a little less. It was 5,000 odd. It was 5,000 odd 2 days back. Now it is 4,316. So coming to the global statistics. Different countries. If you take different countries, USA is having 38,99,387 cases. Brazil 20,99,896 cases. India is 11,19,412 cases, and so on. Russia, South Africa, Peru, Mexico comes next. So coming to the Indian statistics, total number of India cases, positive cases are 11,19,412 cases. Total deaths were 27,514. Among them, 7,647 cases have recovered. So the death rate is gradually showing, shows an improving trend. Recovery rate also improving. Daily cases, July 19, that is yesterday, India has seen 40,243 cases in a single day. Coming to the daily deaths in India, 675 cases has died yesterday in a single day on July 19th. So recovery rates, if you compare recovery rates, it is 3.78% on July 19th, that is yesterday, which is better than day before yesterday. So recovery rate is 96.22% on July 19th, that is yesterday. So overall statistics are showing a good trend. So herewith I am going to present the statistics of different states of India. So Maharashtra trending at the top. Total number of positive confirmed cases are 3,10,045 cases. Next comes Tamil Nadu, which is
please go ahead.
Yeah, there is a network issue. 1 second, sir.
Yeah. Okay.
Yeah. Sorry for the delay. So next comes Delhi. There is 1,23,747. Karnataka 63,000. Andhra Pradesh 49,650 cases. Telangana 45,076 cases. Among Andhra Pradesh, different states, East Godavari is the highest number of cases, 6,146, Karnataka 6,045, Anantapur 5,141, Guntur 4,898, Chittur 4,647, Krishna 3,548, West Godavari 3,337, YSR Kadapa 2,646, Srikakulam 2,569, Nellore 2,386, Visakhapatnam 2,098, Prakasham 1,864, Vijayanagaram 1,430. So these are the present COVID statistics in India, in globe, India, and two different Telugu states. Over to you, sir. Thank you.
Yeah. Thank you, Dr. Yugandhar Reddy, for the detailed statistical analysis of the present scenario of COVID. And for the past few weeks, we are every time inviting guests from different faculties of medical fraternity. We had been inviting critical care management, cardiology, ENT, pediatrics, general medicine, etc. Today, we have got Dr. Bharat, assistant professor from Government General Hospital, Tirupati. He is going to present the current trends in the various protocols of management related to COVID-19. Herewith, I would like to invite Dr. Bharat. Over to Dr. Bharat, please.
So, hello everybody. It is my pleasure to present the COVID management protocols. So, what I am going to do now is, so I'll just give you a brief overview. So, how I am going to differentiate the case. So, based on this, we shall discuss. So, whenever a patient, a COVID positive patient, so reaches the hospital, so what are the differentiating features between mild, moderate, and severe pneumonia? So, how do I categorize? Because generally, mild patients will not require hospitalization; just home isolation will be sufficient. So, moderate patients needs hospitalization, and severe patients generally requires ICU admission. So whenever there is a patient with COVID-19, so we categorize them as mild, moderate, and very severe. So mild means patient is just having fever along with features of upper respiratory tract infection. So he may or may not have upper respiratory tract infection features. So it means that there might be some rhinitis, there can be some throat pain along with that fever. Now the new symptoms patient can present with anosmia, means smell problem, and taste problem, myalgias, that means pain in the muscles. So generally mild patients will eventually recover and home isolation is usually advised. Now what we need to concentrate as a pulmonologist is those who require hospital admission. So we have moderate cases. So moderate cases in the sense they will be having pneumonia. So pneumonia means infection in the lungs. So you can identify infiltrates on the CT scan. Patient will be having some fever and also breathing difficulty. Because of breathing difficulty, his respiratory rate will increase. So this patient, instead of breathing normally like this, he will be taking more and more breaths. And one more important easy feature is getting a pulse oximeter and seeing his saturation. So pulse oximeter is a small mission, so which will help to see the oxygen levels indirectly into the blood. So the level where we can categorize as moderate is less than 95%. See, normally when I put a pulse oximeter, my saturation is generally more than 95. but in these patients, saturation will be only 90 to 94%. So moderate patient, immediately I need to connect oxygen and I should need to shift him to high dependency unit at least. Now, most important is severe cases. So severe cases means they will be having so much of respiratory distress and they require artificial breathing. So they are not able to breathe by themselves properly. So they might require mechanical ventilation, either through a mask called as non-invasive ventilation, or by putting a tube directly into the lungs, that is called as invasive mechanical ventilation. And these patients generally will have respiratory rate more than 30 per minute and saturation less than 90. So if you put a pulse oximeter, their saturation will be less than 90 per minute. So this is the differentiation between mild, moderate and severe. Mild means patient is not having any breathing difficulty, just some fever. Moderate means he is having some amount of breathing difficulty, and if you see saturation, it will be less than 95. Severe means they are having so much breathing difficulty, oxygen is not going into their body, so their saturation will be less. Now I have categorized these patients. How will I approach further? So what should I do for each category? What should be done for mild? What should be done for moderate? And what should be done for severe is the next question. So this is the clinical management protocol of COVID-19 according to the new guidelines released by Government of India. So the new guidelines actually came in 3rd July. So this is very helpful while treating a patient with COVID-related issues. So there is a COVID-19 patient. So there is a COVID-19 patient. So I am categorizing it as, is it mild illness, moderate illness, severe illness? We will discuss in the next slide. So is it mild, moderate? Suppose if this patient is having only mild illness. So I initially admit him in isolation area. So I should assess him. So whether he is having some other issues. So then I decide how to treat and how to send him home. So generally it is symptomatic care. So symptomatic care in the sense, if the patient is having some fever, I generally prescribe common drug called as paracetamol. If patient is having some rhinitis, we generally prescribe a common drug called as cetirizine. If patient is having some cough, we generally prescribe a cough syrup. Along with that, to improve his immunity, we generally prescribe some immunity boosters, vitamins, so vitamin C, zinc, magnesium, vitamin D. So we are not going to do much in mild illness because it will eventually resolve by itself, no need to panic. So initially I admit him, I completely assess his symptoms, and we can give either hydroxychloroquine and Fabiflu. So this is a new drug approved for treatment of COVID-19 in our country. So Fabiflu is the trade name and its original name is Favipiravir, and it is given in high-risk patients. So who are these high-risk patients who require some amount of monitoring even at home? So high-risk in the sense elderly. So if a patient's age is more than 60, he falls into the high-risk category. So generally what I do is, I admit him for 2 days, I observe, then I decide him for home isolation. So if he is a young patient without any comorbidities and he is coming under mild illness, I generally advise home isolation. Or he is having some associated heart disease, kidney disease, liver disease, he is having diabetes, hypertension, or previous lung disease, or he is obese. So who is a high risk patient of progressing in COVID illnesses? Elderly, you should be careful. So patients with these features. So they are having either diabetes, heart disease, kidney disease, liver disease, hypertension, some other lung disease such as COPD, asthma, obesity. So he is a bit overweight, and obesity generally BMI will be more than 30 kg per meter square. So in majority, I no need to worry in mild illness. I send them home, and especially if he falls in high risk patient, I prescribe either hydroxychloroquine. Recently, we are prescribing Fabiflu, and usually we monitor them even at home. Then coming to moderate cases, these patients generally require hospital care. So I'm going to admit him in designated CCU. So that is COVID care unit. So where we take care of this moderate cases, COVID care unit, and his body is having some infection. So along with the viral infection, generally in moderate cases, there might be some mixed infection. So there might be some commonly occurring bacterial infection. So we also start some antibiotics according to the local infection pattern. And we add oseltamivir. So sometimes H1N1 influenza may also coexist, and this is an antiviral, it will help. So generally when oxygen is less in his body, we give oxygen support. And most importantly, awake proning. So awake proning means we ask the patient to lie majority of the time in prone position. So whenever he is lying like this in prone position, the distribution of blood and air into the lungs will be better. So this has been proved beyond doubt. This is very, very helpful in management of COVID patients, especially in moderate and also in severe cases. So we generally advise these patients to lie in prone position so that the distribution of blood to the lungs and distribution of ventilation will be good. And in these patients also, we can start hydroxychloroquine. We can also give Fabiflu. And next important thing is, recent studies have shown that in patients with COVID related disease, especially mild and severe, so in the blood vessels, small clots were accumulating. So because of the viral inflammation within the blood vessels, small clots were accumulating. So whenever a blood vessel is filled with clot, so blood will not flow properly, and the organ preceding this blood vessel will undergo damage. So because of that, we are giving some drugs so which can dissolve these clots. So we usually give anticoagulants which will take care of that clot formation, and one such anticoagulants are enoxaparin. So we give enoxaparin and heparins, unfractionated heparins. So that should be given under your doctor's guidance. And next important thing is, recently they have found out the deaths in these diseases are not due to the viral load. It is because of the hyperinflammatory response. In few patients, what happens is, whenever virus is staying in your body, to drive that virus out, your body gives an enhanced hyperinflammatory response. So because of that hyperinflammatory response, lot of substances called as cytokines will be released in your body. So these cytokines will go to various parts in your body and damage various organs. This phenomena is called as cytokine storm. It means cytokines are coming out like a storm and damaging majority of the organs, and that can eventually result in multi-organ dysfunction and death of the patient. So to bring down that inflammatory response, we give steroids. So preferred steroid is generally either methylprednisolone or dexamethasone. At our center, we have good experience with methylprednisolone. I generally prescribe methylprednisolone for my patients. Apart from this, there are some investigational therapies. So these are not proved yet efficacious, but there have been some studies telling that they are helpful. So such investigational therapies in moderate illness are an antiviral drug called as remdesivir, and also convalescent plasma. So this convalescent plasma is collected from a patient who has already got COVID and he is declared free of COVID. So in his body, antibodies will be present. So we infuse the antibodies into the diseased person, thinking that these antibodies can fight against the virus and save this patient. So these are all investigational therapies. So keep in mind, if somebody is having moderate illness, 4 important things that you should know is, you should give him good oxygen, make sure he is in prone position, antiviral according to the situation, and steroid enoxaparin. So these are the things that should be given definitely. So oxygen, prone position, antiviral according to the situation, steroid, enoxaparin. So these four should definitely be in the treatment of moderate illness. So this can be done usually in a high dependency unit, no need an advanced ICU. And in these patients, we generally avoid nebulizations. So because when the nebulization is done, aerosols may generate in those areas and it can cause some infections in the healthcare workers. Now coming to the next thing, where patients generally become bad, they will be shifted into the critical care unit and they will be categorized as severe illness. So which is called as severe case. So COVID patient with hypoxia worsening. So you are giving oxygen, but still his SpO2 is not maintaining and he is not improving. So in these patients, what should be done? So I give oxygen now through high flow nasal cannula. So this is a device which can push oxygen with more force and also with more concentration. So this is the high flow nasal cannula. So you will be seeing in most of the news, whenever they show a patient with COVID pneumonia in ICU, he will be connected to with this high flow nasal cannula. So rather than the routine nasal cannula, this can give more amount of flow to the oxygen concentration to the patient. And if not possible with high flow nasal cannula, we can go with non-invasive ventilation, generally BiPAP. And for this, we put the patient in a mask like this, so that whenever he is taking breath in and out, he is not able to generate aerosols. So with help of a helmet mask, we generally prescribe BiPAP. So then along with that, routine therapies, we give heparins, we give steroids, and one more drug helpful is tocilizumab. So tocilizumab, it belongs to the class of anti-IL-6. I told you previously, in few patients what will happen is body will give an hyperinflammatory response. So in that hyperinflammatory response, most important substance is a cytokine called as IL-6. A cytokine called as IL-6. So this is the cytokine ultimately damaging majority of the organs. By giving an anti-IL-6, the effect of this IL-6 to cause damage can be decreased. So here important drug that we should know is tocilizumab, generally reserved for severe cases. And whenever patient is not at all breathing, suddenly he stopped breathing, or there is severe respiratory distress, even if you are giving oxygen, there is cyanosis. So bluish discoloration of the tongue, it means oxygen is not going into his blood properly, or patient develops very low blood pressure, patient is in coma, or he is developing convulsions. In these conditions, what we should do is, we should put an endotracheal tube and we should ventilate the patient. So this phenomena is called as invasive mechanical ventilation. So here also, whenever you are intubating, whenever a critical care physician is intubating, he should intubate with the necessary precautions. You can see they are wearing full PPE, using a video laryngoscopy and trying to insert a tube into the patient's trachea. So whenever we intubate this patient, we have to follow a protocol for invasive mechanical ventilation. And in these patients also, when you intubate, later you should put the patient in prone position so that the oxygenation and the perfusion is very well maintained. So this is the management of a mild case, a moderate case, and a severe case, especially in ICU. So this is the prone position that we follow. So you can see this patient is connected to a ventilator. This is the tube. We put the patient in prone position and we ventilate. In few patients, we go for an advanced therapy called as ECMO. So ECMO means extracorporeal membrane oxygenation. Extracorporeal membrane oxygenation. So most advanced therapy. So what will be done in this ECMO? So this is a mission. You can see in this image, what it does is, it will take the deoxygenated blood means oxygen less blood from the body is taken into a mission. So what will that mission do? It will add oxygen to that blood. So this oxygenated blood will be going back into the body. It is just like pulling out deoxygenated blood with less oxygen, sending it into a mission and getting that blood oxygenated, sending it back into the body. Because it is happening outside the body, it is called as extracorporeal. It is happening outside the body, it is called as extracorporeal. And this mission is membrane oxygenated, so it is called as extracorporeal membrane oxygenation. So this is considered as the final therapy when our patient is unable to maintain oxygenation even after invasive mechanical ventilation and putting the patient in prone position. So these are all the drugs which were found to be useful in COVID. So this is just for information purpose. So don't think that all these drugs should be given to a single patient. So it is always based on the clinical scenario and the clinician's perspective of the disease. So don't think all these drugs should be given together to a patient in COVID related disease. According to that situation, your doctor will decide what is best for this patient. I am seeing so many people putting to me in messages in WhatsApp, sir, this remdesivir, will it work in all patients? See, nobody has complete studies that it will work. So in panic, so many people are buying out remdesivir. Even mild cases are now telling that, sir, give me remdesivir. See, always treatment should depend upon the current clinical status of the patient. So in mild case, nothing much to do. In moderate, there is hard work. And in severe cases, that is the hardest part in dealing with the patient. So these are some drugs available. Hydroxychloroquine, everybody must be knowing. Oseltamivir, actually it was prescribed for swine flu. There is some role even in COVID pneumonia. Another drug, remdesivir. Previously, we were giving lopinavir, ritonavir combination. Other drugs, interferon beta-1, tocilizumab we have discussed, and convalescent plasma, infusing plasma from a cured patient to send antibodies in the patient. Then recent drug, Fabiflu, also called as favipiravir. And most important thing that you should know is, if somebody asks me, sir, what is the drug of choice? What drug will best act on the virus? As of now, there is no such drug which can 100% kill the virus. So there is no specific antiviral. If somebody asks me, sir, what is the best drug for malaria? What is the best drug for some tuberculosis? Or what is the best drug for some other infection? There are some drug of choice. But as of now, for COVID-related pneumonia, COVID-related illness, there is nothing called as ultimate drug, best drug. So there is no specific antiviral till date. So all these drugs have some role which might decrease the severity of illness. It is not 100% if I use this drug, patient will recover. So sometimes they may or may not recover. That should be kept in your mind. And finally, what is the current discharge policy? So now you have treated this patient, how to decide whether the patient can go home. So there is a confirmed COVID-19 case. I'm going to divide it into three categories again, as I told you. So there is a mild case, moderate case, severe case. So when can they go home? And next important thing is, should they be tested again before going to home? According to new guidelines, no need to test all patients before sending them home. So this is the recent guidelines. So if he is having mild symptoms or no symptoms, you can discharge him after 10 days directly. No need of any repeat test. But most important thing is, in last 3 days, he should not be having any symptoms. So no RT-PCR needed before discharge. So this RT-PCR is a diagnostic test which can generally detect COVID. And if he is having moderate illness, so moderate illness, later on everything is resolved and he is not on oxygen support. So you can discharge him without testing. So just prescribe some necessary medications and you can discharge him without testing. Now moderate symptoms are not getting resolved and still oxygen therapy is needed, but you cannot keep him in hospital for long because new patients will be coming. So he is still not going into severe. You have observed him for more than 10 days. You feel that he requires oxygen. It can be managed at home also. So what we do is we should make sure that all the clinical symptoms are resolved and he should maintain oxygenation for 3 consecutive days. So then also you can discharge him without testing. So without testing when to discharge in mild and moderate. In moderate also, so sometimes because beds are not vacant, what they're doing is, so from the ICU, from the high dependency unit, once he is maintaining only with oxygen, so they bring him to a general ward. So they wait for 3 days, 4 days, and make sure that he is not having any symptoms, and they discharge him later. The next is in severe cases, you should discharge complete recovery, only after complete clinical recovery, and patient should be tested negative once by RT-PCR after resolution of symptoms. So as of now, retesting is only indicated in severe cases. So where they should completely recover, they should come from the ICU, high dependency unit, then into the room, and you should test him and he should be proved negative, then you should send him home. So for mild cases and majority of moderate cases, no need of retesting. But in severe cases, who patients recovered from severe illness, they should be retested before sending them home. So this is my talk regarding the treatment of COVID pneumonia, the management protocols, rest. So now I hand over this to Dr. Yugandhar sir.
Thank you, Dr. Bharat, for an excellent and elaborate presentation. And again, what is happening and what is most important to understand for the viewers, for the general public, is the treatment protocols have been changing since COVID-19 has entered the scenario of the globe. Because it is a mysterious virus, though coronavirus has been known to the medical professionals for the past few decades, the mutated coronavirus, which is otherwise called as COVID-19, is altogether a different genetic makeup. And the protocols have been changing every few weeks. So the recent protocol, as per the guidelines of Central Government of India, has been very clearly discussed and very clearly evinced by Dr. Bharat. Thank you, Dr. Bharat, for this elaborate presentation. And I think people will be very much benefited for the information knowledge. And please do not neglect whatever symptoms that you are having. Please consult the nearest doctor and they will be definitely happy. So, Dr. Yugandhar Reddy, do you have any statistical analysis and recovery date? Any update on that?
Yes, sir. Latest recovery rate is it is published on July 19th. That is yesterday. That is 96.22%. It is gradually every day it is getting better, sir, compared to 2 days back, when we have discussed it is only 96.08%. Now it is 96.22%. Death rate has fallen further. Death rate is present, it is 3.78%.
Okay.
So overall, it is showing a favorable trend.
Okay, but the incidence appears to be a little high.
Yes, sir.
Yeah, incidence appears to be little high, and today Telangana state has recorded all-time high, it seems, as per the TV channels. And
yes, sir.
do you have any online data in Telangana state?
Yes, sir. I have Telangana data. So it is now 45,076 new cases are there, sir. Active cases are 12,200. Active cases 12,223. Coming to the Yeah, confirmed cases are now 45,076 cases, sir.
Okay. So thank you very much, Dr. Yugandhar Reddy. Once again, thank you very much, Dr. Bharat, for detailed presentation. And day after tomorrow by 7 p.m. Yeah. Day after tomorrow, 7 p.m., we again meet with some more information, maybe on the preventive aspects, maybe sanitation and usage of masks, usage of face shields. And we'll also invite some of the epidemiologists from social and preventive medicine experts. And after 48 hours, we are going to meet again. Thank you very much.